Does eating too much calcium really cause kidney stones? Imagine this. You're suddenly hit with a pain so intense, it feels like tiny needles are piercing you from inside and your insides are being twisted and squeezed. It's a pain that makes you double over, unable to think about anything else. This is what it's like for someone with a kidney stone, a tiny crystal that forms inside the kidney and starts its tortuous journey through the body. The pain comes in waves, so strong that you can't find a comfortable position, walking around in agony, hoping for some relief. Many people think this unbearable pain is caused by eating too much calcium, like the dairy in your cheese or milk. But is that the real culprit? Imagine the surprise when we dive into this question, exploring if the very thing we've been told could be causing our suffering might actually be a misunderstanding. Let's get to the bottom of this and see if the calcium we've been avoiding is really the enemy, or if we've been misled by a common myth. In this video, I will be explaining kidney stones, how they form, why they form or the causes, the symptoms and of course the medical and alternative treatments. So make sure to sit tight and watch this video to the end and don't forget to like and subscribe. For those that are new to the channel, I am V and welcome to the best health channel on YouTube where we talk about everything related to your health and wellness. A kidney stone is a solid piece of material that forms in a kidney when substances that are normally found in the urine become highly concentrated. Think of your kidney as a filter that cleans your blood, removing waste and extra fluids to make urine. Sometimes, when there's too much waste in too little liquid, crystals begin to form. Over time, these crystals can join together and grow into a kidney stone. Do you know what happens next? These stones have sharp needle-like edges. They lodge in your kidney or ureter, blocking flow of urine. You know the pain you feel when you hold your pee for a long time. Multiply that by 10 and then add like tens of needles pricking you at the same time. I honestly don't know if this explanation makes sense to you, but it is the best way I can explain it. Now back to the opening question. The belief that a high calcium diet directly causes kidney stones is a common misconception. In fact, the opposite is often true. A diet with adequate levels of calcium can actually help prevent the formation of certain types of kidney stones, specifically calcium oxalate stones, which are the most common type. Here's why a high calcium diet does not necessarily cause kidney stones. Calcium binds oxalate in the gut. When you consume calcium and oxalate foods together, calcium binds with oxalate in the gastrointestinal tract. This binding process reduces the amount of oxalate available to be absorbed into the bloodstream and subsequently excreted into the urine, where kidney stones form. Thus, dietary calcium can actually lower the risk of forming calcium oxalate stones. The role of dietary calcium. Studies have shown that dietary calcium is not the primary cause of calcium oxalate stones. In fact, a diet low in calcium has been linked to a higher overall risk of developing kidney stones. It's because a lower intake of dietary calcium could lead to higher oxalate levels in the urine. Adequate dietary calcium intake is crucial for binding oxalate in the diet. Supplemental versus dietary calcium. It's important to distinguish between dietary calcium and calcium supplements. Some research indicates that taking high doses of calcium supplements might increase the risk of stones because supplements might not bind to oxalate in foods if they're not taken together. Therefore, getting your calcium from food sources is preferred over supplements for stone prevention. Balanced intake is key. While a normal intake of calcium from foods is beneficial, excessively high levels of calcium from supplements, for example, without a corresponding intake of other nutrients, may not offer the same protective effects and could potentially contribute to the formation of stones if it leads to high levels of calcium in the urine. But, what actually causes kidney stones, or what are the risk factors of developing kidney stones? Kidney stones have several risk factors that can increase an individual's likelihood of developing them. Understanding these factors can help in managing or reducing the risk. Here's a detailed look at each. Dehydration, not consuming enough fluids, especially water, leads to concentrated urine. This concentration can cause minerals to crystallize and stick together, forming stones. Dehydration is more common in warm climates and among those who sweat a lot. Diet. Certain dietary choices can influence the risk of kidney stones. High sodium intake. A diet high in salt increases the amount of calcium in urine, which can lead to the formation of calcium stones. High protein intake. Diets rich in animal proteins, meat, eggs, and seafood, can increase uric acid in urine and reduce levels of citrate, a substance that helps prevent stones. High oxalate intake. Foods high in oxalates, such as spinach, beets, and nuts, can contribute to the formation of calcium oxalate stones. Low calcium intake. Ironically, A diet low in calcium can also contribute to kidney stones. Dietary calcium helps bind oxalate in the intestines, reducing oxalate levels in urine. Obesity, being overweight or obese, increases the risk of kidney stones. Higher body mass index, BMI, is associated with changes in acid levels in urine and increased excretion of calcium and uric acid, creating an environment more conducive to stone formation. Medical conditions. Some health issues can make a person more prone to developing kidney stones, such as renal tubular acidosis, a condition that leads to acid buildup in the body, causing calcium stones to form. Cystinuria, a hereditary disorder where the kidneys excrete too much of certain amino acids, cysteine, leading to the formation of cystine stones. Hyperparathyroidism, the overproduction of parathyroid hormone increases calcium levels in urine, potentially leading to calcium stones. Urinary tract infections, UTIs. These can lead to the formation of struvite stones, which can grow quickly. Personal or family history. If you've had kidney stones before, you're more likely to develop them again. If family members have had stones, you may be at increased risk due to shared genetic or environmental factors. Certain medications and supplements. Some medications, including diuretics, water pills, anti-seizure drugs, and calcium-based antacids, as well as vitamin C supplements and certain dietary supplements, can increase the risk of kidney stones. Other dietary factors. A diet high in sugar, including fructose and sucrose, can increase the risk of kidney stones. Fructose can increase the excretion of calcium, oxalate, and uric acid, contributing to stone formation. Gastrointestinal disease and surgery. Conditions like inflammatory bowel disease or surgeries like gastric bypass surgery can affect calcium and water absorption, increasing the risk of forming kidney stones. By understanding these risk factors, you can take steps to modify your diet, lifestyle, and hydration habits to reduce the likelihood of developing kidney stones. Kidney stones come in several types, each with distinct appearances and causes. Understanding these can help in preventing their formation and choosing the appropriate treatment strategy. Here's a breakdown of the types of kidney stones. Calcium oxalate stones. They are the most common type and can look like small, rough stones, often dark in color. Under a microscope, they might appear as sharp, crystalline structures. These stones form when calcium combines with oxalate in the urine. Factors contributing to their formation include high levels of calcium or oxalate in the urine, which can result from dietary choices, like too much oxalate-rich food, vitamin D supplementation, and metabolic disorders. Calcium phosphate stones. Similar to calcium oxalate stones but tend to be smoother and are often light in color. They can also form larger, branched stones known as staghorn calculi. These stones form when urine is alkaline, high pH. Conditions that lead to their formation include renal tubular acidosis, certain medication uses, and genetic conditions. Uric acid stones tend to be smooth, soft, and reddish-brown. They are often not visible on conventional X-rays because they are radiolucent. High levels of uric acid in the urine lead to these stones, often due to a high-protein diet, gout, diabetes, or obesity. A persistently acidic urine pH also contributes to their formation. Struvite stones. These stones can grow rapidly and form large, horn-shaped structures, staghorn calculi, that occupy a large part of the kidney. They are composed of magnesium, ammonium, and phosphate. Struvite stones typically form after urinary tract infections with bacteria that produce urease, an enzyme that increases the urine pH and leads to stone formation. Cystine stones. They can vary in color from yellow to orange and are often somewhat softer than other types of stones. Under the microscope, they have a distinct hexagonal shape. Cystine stones result from a rare genetic disorder called cystinuria, which leads to excessive excretion of the amino acid cysteine in the urine. Cysteine is poorly soluble in urine and can form stones. Now, talking about the symptoms, kidney stones can manifest a range of symptoms, from subtle, early signs to more severe, late-stage indicators. The symptoms often become apparent as the stone moves within the kidney or into the ureters, the tubes connecting the kidneys to the bladder. Here's a progression of symptoms from earliest to late stages. Early symptoms. No symptoms. Small stones might not cause any symptoms while they remain in the kidney. Pain on one side of your back or lower abdomen. The earliest symptom might be a mild discomfort or a sharp pain that comes and goes, often called flank pain, which can be felt on one side of the body between the upper abdomen and the back. Blood in urine, hematuria. Stones can irritate the kidney or the ureter. causing blood to appear in the urine, which might be pink, red, or cola colored. Frequent urination, an urge to urinate more often than usual, especially if the stone is near the junction of the ureter and bladder. Painful urination, when the stone reaches the bladder or urethra, urinating may cause discomfort or a burning sensation. Intermediate symptoms include nausea and vomiting. The severe pain caused by kidney stones can lead to feelings of nausea or actual vomiting, as the body reacts to the intense pain. Cloudy or foul-smelling urine. The presence of a kidney stone or infection can make the urine cloudy or cause it to have a strong, unpleasant smell. Late symptoms include persistent pain. As the stone moves down the ureter closer to the bladder, the pain can become more persistent and intense, often described as one of the worst pains experienced. Fever and chills. If an infection develops in the urinary tract due to the obstruction caused by the stone, fever and chills might occur, indicating a more serious condition that requires immediate medical attention. Obstructed urine flow. Large stones can block the flow of urine, leading to severe pain and potentially causing the kidney to swell, hydronephrosis, which might result in damage if not treated promptly. Note that the symptoms of kidney stones can vary greatly depending on the size and location of the stone, and not all individuals will experience all these symptoms. Small stones might pass without causing more than mild discomfort, whereas larger stones can cause significant pain and complications. If you suspect you have kidney stones, especially if experiencing severe pain, blood in your urine, or signs of infection like fever and chills, seeking medical evaluation is crucial. Treating kidney stones involves a combination of medical interventions and, in some cases, alternative treatments, depending on the size, type, and cause of the stone, as well as the severity of the symptoms. Here's a breakdown of the various treatment options. Medical treatments. Pain management. Nonsteroidal anti-inflammatory drugs, NSAIDs, or acetaminophen are often recommended for managing the pain associated with kidney stones. Severe pain might require stronger prescription medications. Fluid intake. Increasing water consumption is advised to help flush the stones out of the urinary system. For stones due to dehydration, this can be especially effective. Medical expulsive therapy, MET. Medications like tamsulosin, Flomax, or nifedipine, Procardia, can relax the muscles in the ureter, helping the stone pass more easily and reducing pain. Lithotripsy, extracorporeal shock wave lithotripsy, ESWL, uses sound waves to break up large stones into smaller pieces that can be passed more easily. Ureteroscopy. A small scope is inserted into the urethra and bladder to the ureter where the stone is located. The stone is then removed or broken into smaller pieces with a laser. Percutaneous nephrolithotomy. For very large stones, a surgeon makes a small incision in the back and removes the stone through a tube. Traditional open surgery is rarely performed today but may be necessary in exceptional cases where the stone is exceptionally large or in a location that other treatments can't reach. Alternative treatments. While alternative treatments alone cannot always remove kidney stones, they can complement medical treatment and help prevent further stones from forming. Increased water intake. Though also a medical recommendation, it's considered a natural remedy. The goal is to produce at least 2.5 liters of urine a day. Dietary changes. Reducing intake of oxalate-rich foods. For calcium oxalate stones, lowering salt and animal protein intake can help prevent stone formation. Increasing dietary calcium intake, not supplements, may also be recommended to reduce the risk of calcium oxalate stones. Lemon juice. Yes, you heard that right. Citrate in lemons can inhibit stone formation and break up small stones. Drinking lemonade or lemon juice mixed with water may help prevent or slow the growth of stones. Apple cider vinegar contains citric acid, which is believed to soften, break down, and dissolve kidney stones. However, scientific evidence supporting its effectiveness is limited. Herbal remedies. Certain herbs, like chanca piedra, also known as stonebreaker, are thought to help dissolve kidney stones. However, scientific validation of these remedies is limited, and they should be used cautiously, especially in consultation with a healthcare provider. Before you start any alternative treatment, have this in mind. Consultation with healthcare providers. Before trying any alternative treatments, especially if you have underlying health conditions or are taking medications, it's crucial to consult with a healthcare provider. Potential risks and interactions. Alternative remedies might interact with medications or worsen certain health conditions. As we conclude this video on understanding the complexities and causes of kidney stones, it's imperative from a physician's perspective to emphasize the importance of nurturing your body. The journey through the causes of kidney stones unveils a crucial lesson. The choices we make daily have profound impacts on our health and well-being. Our bodies, these intricate systems of balance and function, depend on us to provide them with the care, nutrition, and hydration they need to operate smoothly and efficiently. The formation of kidney stones is a clear signal from our body that something is out of balance. Whether it's our diet, hydration levels, or underlying medical conditions, it's a reminder that we need to pay attention to our health. By understanding the causes of kidney stones, we're equipped with the knowledge to make informed decisions about our lifestyle and diet, decisions that can significantly reduce the risk of experiencing this painful condition. I urge you, as part of the general public, to view this information not as a mere collection of medical advice but as a call to action. Be kind to your body, for it is the only one you have. Provide it with the nourishment, hydration, and care it requires. In return, your body will serve you well, affording you the health and vitality to enjoy life to its fullest. Moreover, I encourage you to stay engaged with your health by seeking out reputable sources of medical information, asking questions, and sharing what you've learned with others. If you found this discussion enlightening, I invite you to like and subscribe for more insights into maintaining your health and preventing common ailments. Together, let's commit to a lifestyle that fosters well-being, recognizing that when we are kind to our bodies, they are incredibly kind to us in return. Remember, health is not merely the absence of disease but a state of complete physical, mental, and social well-being. Take care of your body, cherish it, and it will indeed be kind to you in return.